I think that what we need in healthcare analytics is for analytics to move out of one small analytic department in a health plan. If we're talking about silos, we need to break out of the silos and have more in that platform than we currently have, or more being used than is currently being done. That we need the users of the platform to be in departments all around the company, and we need to have the results and the analytics in there that speak to all of the things that a health plan does. And so going from just quality, from your STAR score, from your risk score, in bringing in experience, which brings in a different part of the company that's working with member experience, and then bringing in other financial tools, bringing in equity as a major part of it, having equity be available in every single aspect of the tool, so we can see where needs are and how it influences the results that you're looking at. That starts moving the analytic platform out from just that one area inside a small department. And then also make it accessible. That these enterprise software analytic platforms are really difficult to use because there's a lot in them. But users around the company should be able to log in and just see where are we now and where are we going. Just that basic piece of information that right now is often a spreadsheet being emailed around a company, that we should be able to go in and get that easily and have it be something which is actionable and usable. And then finally, when you get to the results, what do you do about them?
The two trends, interoperability and transparency. So interoperability, meaning that the data should be available, like you said, from department to department, usable from department to department, even with our vendors. So it should be bi-directional. So I shouldn't have one vendor asking and then another vendor asking the same thing when I have that piece of data. Or if something important changes and this vendor knows about it, I want to be able to take action on that data, right? Not that this exists alone in a silo, like you were saying. From the transparency side, I think it's so important for value-based care for patients or members to take charge of their own health and have that agency, and to understand why are we asking, why are we measuring, where do they stand, how do they compare, why is it recommended, what action do they need to take, and to be able to, again, we talked about this earlier, meet them where they're at, right? So give them the information in a way that they're able to access, whether it means it's on their smartphone, a tablet, telephonic, it's on a desktop, we send it to them via paper, we send it to them in a text, whatever that is, that omni-channel communication to deliver that transparency, I think is key to meeting members where they're at and being able to serve them in the best possible way that's going to drive not only the quality measures, but reducing costs and all of the key performance indicators that we've been talking about.